Hi friends, have you ever noticed that little bit of sleep or crust in your eyes early in the morning when you wake up? Some people call it eye gunk or eye goop or eye goobers, eye boogers or sleep crust. So whatever you may call it, it's usually harmless, and today we are going to talk about that. So stay tuned. So what is it? During the day, our eyes are kept moist and healthy by a layer of tear film. And when we blink, we wash away tiny bits of these mucus, oil and debris out of the eye. But while we are asleep, the same tear film, because we are sleeping, we don't blink, all this mucus, oil and debris, it collects in the corners of the eye or along the lash line. It dries up, and this is what you see in the morning as sleep crust. Now that sleep crust or eye gunk can look different for everyone. Sometimes it looks clear and sticky. At other times it might be yellowish and dried. But if you are seeing a lot of thick colored discharge, if your eyelids are stuck, if your eyes hurt, if they are red or swollen, and your vision is blurry, it might be more than just eye gunk. Then it's time to visit the doctor, because it might be the pink eye or conjunctivitis, or it could be blepharitis or dry eye. So it's always better to go to an eye specialist and get it checked. And now if you want to clean that eye crust safely, here's what you have to do. Always wash your hands first, then take a clean washcloth, soak it in warm water, not hot, and gently place it over your closed eyes for a few seconds. This will soften the crust. Then you can gently wipe along the lash line to clean it away. Don't rub your eyes with your fingers, as that can carry germs and cause infection. And if your eyes are having an infection, then it's always better to use separate washcloths for the two eyes, so that the infection is not transmitted from one to the other. Now, if you are having a pink eye, the type of discharge can tell you what kind of conjunctivitis it is. A thick yellowish or greenish discharge which makes your eyes stick shut in the morning usually is because of bacterial conjunctivitis, and this is contagious also, and you need to use an antibiotic for that. A discharge which is more watery is usually because of viral conjunctivitis. This is also contagious, and usually it is accompanied by an upper respiratory tract infection. Another type of watery discharge which is also stringy in character but is associated with a lot of itchiness is because of allergy, and this is allergy related and this is not contagious. So the type of discharge can give you a clue about what kind of conjunctivitis you are suffering from. So next time when you wake up with a little bit of sleep in your eyes, don't worry, it's your body doing its job. But if you feel that something is not right, if you feel unusual, then the safest thing is to check with your eye doctor. If you found this helpful, blink twice and hit that like and subscribe button for more eye-opening tips. Like, share and subscribe. Keep watching.